Health officials on Monday, January 25th, confirmed the presence of the UK COVID-19 strain B117 in St. Lucia. Health officials are now battling a more infectious variant of the virus with a 70% transmissibility rate, as well as mounting positive cases.
The form of the disease is not more severe. That is, it is affecting people the same way. So the death rate is not more. The signs and symptoms are not more severe. It is not killing people more. People are not suffering more with it. The only change that they have noted at this point in the research is that it is transmitted faster.
The established mitigation measures of social distancing, hand washing, and mask wearing were touted as the correct line of action, even against the more contagious variant. 6 variants of COVID-19 have already emerged worldwide. Dr. Belmar George has attempted to quell apprehension over the mutating virus.
COVID-19 is not behaving any different to viruses. Viruses are simple organisms. They are known to mutate frequently. So this is not unusual. Just as we see influenza mutates every year we need a new influenza vaccine. It's a similar case that's happening with COVID-19, where it mutates, it changes, and some of the characteristics of the virus also changed.
Sample and testing of the new variant was facilitated by the Caribbean Public Health Agency, CARPHA. According to Director of the Ezra Long Laboratory, Dr. Wayne Felicier, the provision of training is anticipated so the facility can carry out its own gene sequencing.
CARPHA has provided support for us throughout this testing process, and the gene sequencing is another component that they've added. They're outsourcing it from what Dr. Belmar just referred, and that means that they're sending it to us, a reference lab that can. We are going to be in discussion with PAHO, with the virologist, Lionel Gresh, to see how we can develop that capacity on island. So that's some level of training that we're going to undergo, and hopefully we could start detecting other variants apart from the UK variant or whatever other variants that exist within our society.
Director of the Respiratory Clinic, Dr. Alicia Eugene Ford, cited the new WHO and CDC guidelines for revised admission and discharge from the hospital setting. She also notes the addition of 44 beds at the hospital, bringing the capacity to 126.
In addition to the extra beds, you'd obviously need extra staffing, and then arrangements are already being made to bring in extra nurses, extra physicians, the clinical support staff, the porters, the domestics. All of these are it's happening already in the pipeline. So it's a situation where changes are being made slowly to accommodate the increase in patients that are coming in.
The health officials also noted the addition of 2 hotels for the containment and isolation of patients. And despite the new variant raising anxieties, the chief medical officer confirmed that the approved vaccines are effective against the strain. Solange Alfred, HTS News Force.